Good morning, everyone. Today, the purpose of this video is to talk about the NCLEX test plan. And what exactly does it mean to you and me in plain English? So I've taken the time to write it all down, and I'm going to explain it to you because people don't understand it. You get this piece of paper in the mail, whether you passed or whether you failed, and it says near passing, passed. What does it mean? What does that mean in plain English? Okay? Now, I've been helping with the NCLEX specifically since 1997. So that's a topic that's very near and dear to my heart. And really, nobody can tell me anything that I don't know about the NCLEX. So I would really like to explain this to you because I'm getting a lot of email and this really needs to be explained. Now, when you listen to this video, this holds true to both the RN and the LPN. Now, am I going to put up specific numbers? Absolutely not. Because before you know it, the NCLEX test plan is going to change for the RN again, it's going to change for the LPN again. I'm not going to do that. I'm not interested in specific numbers. I'm interested in helping you understand in plain English what the test plan means and how it has changed for both the RN and the LPN. This is what I'm going to explain to you today. Alright? So, listen carefully, please. For both the RN and the LPN, content area client test plan categories, management of care has increased by 1%. Okay? If you want to know the specifics, please just visit my website and click on the prospective RN page, whether you're an RN, or the LPN page, whether you're an LPN. I will have the updated test plan there for you, always. So, management of care has been raised by 1%. Safety and infection control has been raised on the test plan by 1%. Okay? Health promotion and maintenance has stayed the same. Psychosocial integrity has stayed the same. Basic care and comfort has stayed the same. Pharmacological and peripheral therapies has decreased by 1%. And I think the reason behind that is because we will always have a nurse's drug guide, okay? The physicians will always have a physician's desk reference. Don't get me wrong, ladies and gentlemen. There's going to be a lot of pharmacology on the NCLEX. Whether you realize it or not, they claim they decreased it by 1%. I'm still working on a series, a pharmacology series, to figure the pharmacology out. That's a slow-going process for me because I don't know the meds any more than anyone else. I know what I want to teach you. I can't find it in the books. The books are too extensive. We're not going to be pharmacologists. We're going to be nurses with our nurse drug guides. Okay? But for the NCLEX, we have to know our pharmacology. So I'm working on a series with that. Reduction of risk potential has decreased by 1%. And then the last category, category number 8, physiological adaptation has stayed the same. Now, you might be thinking to yourself, well, what is physiological integrity? Alright, physiological integrity category remains the majority of the questions on the exam. About 43 to 67%, so that's a huge chunk of the NCLEX, right? This portion of the NCLEX deals with adult medical and surgical care, pediatrics and gerontology, which is the study of the elderly and the way it affects aging, okay? We know what gerontology is, okay? The study of the elderly and the effects on the aging, okay? Some of the questions may deal with conditions that nurses treat on a regular basis, such as diabetes, cardiovascular disorders, neurological disorders, renal diseases, respiratory diseases. In addition, questions on traumatic injuries, immunological disorders, skin disorders, infectious diseases can be asked. There are different topics on the NCLEX pertaining to the pediatric client. These topics may include growth and development, birth abnormalities, child abuse, common infection diseases of children, and usually childhood traumas such as brain injuries and fractures. Alright. Now that's still not making a whole lot of sense for you. But I want you to know that this takes up the majority of the NCLEX, is physiological integrity. Okay, 43 to 67%. Which I would consider core nursing or basic nursing. Okay, now many of you have listened to my 8 essential concepts for the NCLEX. On the NCLEX, you have to get 50% of the expert questions correct. So my video on the 8 essential concepts of the NCLEX will help you with the expert questions. What I just went over here helps you with core nursing, what you should have learned in school, right? College. But still, what does that exactly mean? And let me break it down further. So, contents break down into 4 categories. So, physiological integrity breaks down into 4 categories. Number 1, basic care and comfort. Now, what kind of questions might fall under basic care and comfort? Okay? First of all, what is basic care and comfort for the NCLEX? Okay, basic care and comfort is providing comfort and assistance in the performance of ADLs. I'll say activities of daily living. Okay, so basic care and comfort is providing comfort and assistance in the performance of activities of daily living. So what kind of questions might this cover? Well, these would be questions having to do with assisted devices, nutrition and oral hygiene, elimination, personal hygiene, mobility and immobility, rest and sleep, and non-pharmacological comfort measures. So these are the types of questions that will fall under basic care and comfort. If you need to, just stop this video, rewind it, take notes. Alright? The second category that falls under physiological integrity is pharmacological and parenteral therapies. What is that exactly? Well, that is providing care related to the administration of medications and parenteral therapies. What kind of questions would this fall under for the NCLEX? Well, questions would include like adverse side effects, contradictions, bad interactions, or how medications interact with herbs. Don't forget your herbs, okay? Expected actions, outcomes, medication administration, blood and blood products, parenteral intravenous therapies, CVA devices, let me spell it out for you. Central venous access devices, okay? Pharmacological pain management, dosage calculation, and total parenteral nutrition, okay? So these kind of topics would fall under the second category, which is pharmacological and parenteral therapies. Physiological integrity also includes the third content, which is the reduction of risk potential. What exactly is the reduction of risk potential? Well, that is reducing the likelihood that clients will develop complications or health problems related to existing conditions, treatments, and procedures. Questions that would include this type of content are questions about changes or abnormalities in vital signs, diagnostic tests, potential for complications from surgical procedures, and health alterations, laboratory values. By the way, every book is different. Every lab is different. So when we talk about lab values for the NCLEX, in order for it to be wrong on the NCLEX is going to be like way off. Okay? Let me see if I can think of one example. Okay, let's take something simple, like blood sugar. I'm going to say, in my book, and according to my labs, normal blood sugar is 70 to 120. Now, you're going to have something different in your book, okay? And the NCLEX will have something else different, okay? On the NCLEX, for the blood sugar to be off, blood sugar being a lab value, it's going to say like 255, 300. See how that's way off? That's nowhere near 70 to 120. So for the NCLEX, the lab value is going to be way off for it to be wrong. Okay? If it's close, then don't worry about it. It's correct. Okay? So that covers lab values. Okay, getting back to the reduction of risk potential and the kind of questions that would cover. It would cover system-specific assessments, potential for alteration in body systems. This is why I have that 9-system review. So if you feel that you're weak in any system, endocrine, OBGYN, which would fall under women's health on my website, okay, you can order those MP3s or CDs separately if you're weak in one specific area. You don't have to get the whole thing, okay? So have a look on my website for that. Therapeutic procedures, potential for complications of diagnostic tests, treatments, and procedures. This is, by the way, all that I'm saying is not an inclusive list, okay? But it does cover the majority. So all of this would fall under the third content in this category, which is reduction of risk potential. Okay? Again, the fourth category, which falls under physiological integrity, which is the majority of the exam now, for both LPNs and RNs. You got that? Thanks, guys. You're doing a great job. Is physiological adaptation. Now, what is physiological adaptation? Well, physiological adaptation is managing and providing care for clients with acute, chronic, or life-threatening physical health conditions. What types of questions would this involve? Alteration in body systems, okay? Medical emergencies, that's why I did the triage. Fluid and electrolyte imbalances, again, if you don't know them, you can just get the MedSurg fluid and electrolyte on my website, the 9-system review. Pathophysiology, hemodynamics, unexpected responses to therapy, and illness management. Okay? All of this, physiological integrity, breaks down into 4 categories. 1, basic care and comfort. 2, pharmacological and parenteral therapies. 3, reduction of risk potential. 4, physiological adaptation. Go ahead and listen to this video again. And the next video, the next section I'm going to cover is safe and effective care. But this, to me, is the most important, because this covers 43 to 67% of your exam. Okay. Again, in closing, I just want to say, management of care has been increased on the NCLEX by 1%. Safety and infection control has been increased on the NCLEX by 1%. Health promotion and maintenance has stayed the same. Psychosocial integrity has stayed the same. Basic care and comfort has stayed the same. Pharmacological and peripheral therapies has decreased by 1%. Reduction of risk potential has decreased by 1%. Physiological adaptation has stayed the same. Alright, gang, I got to answer this call. Thanks a lot. I'll be right back with the second part. Thank you, guys.